Occlusion Laboratory Video Guides, Video 9, Selective Grinding. The main materials needed for this exercise would be newly articulated models, articulating paper, shim stock, and a sharp tool. Make sure your Bennett angle is set to 15 degrees and your condylar angle is set to 30 degrees. Also, raise your incisal pin about 3 to 4 millimeters off the table. The first thing we will do is check the contact points of your articulated models. The goal in this exercise is to achieve maximum intercuspation. In other words, we are trying to make maximum contact with as many tooth surfaces as we can. Even though the articulating paper might make marks on each tooth, it does not mean that the contacts are strong enough. This is why we use shim stock to check that contacts are tight. If you are able to pull the shim stock out from the occlusion, then the contacts are too light. In order to achieve maximum intercuspation, we must begin to reduce the highest part of the occlusion. In order to do this, we must follow a set of rules. The most important rule is an acronym called BULL. BULL stands for buccal upper cusps and lingual lower cusps. This refers to the cusp that you will be reducing on each model. The reason we reduce these specific cusps is so we do not damage the vertical dimension of the patient. There are some instances where you will need to touch the supporting cusps. In such an instance, the supporting cusp will make contact during centric and eccentric movements. This is one of the few times you can reduce a supporting cusp. Throughout the exercise, check frequently with shim stock if the contacts are becoming tighter. Contacts should be present in the posterior and anterior portion of the occlusion. Once all contacts are tight, we can now move on to anterior guidance. Take note that you will not have markings for every supporting cusp and receiving area. We are looking for maximum intercuspation, so all we need is most of them. Next, we will check right and left lateral excursions for canine guidance. Here you can see the interference on the first premolars. Because this supporting cusp makes contact during centric and eccentric positions, it is okay to reduce it. However, make sure this is last resort, and if you can, reduce the inclines, not the cusp tip. Your canine guidance should look as shown during both left and right lateral excursions. The last step would be to check for anterior guidance. Here we will only be looking for contact on numbers 8 and 9 during protrusive movement. Any noticed high points can be reduced. Usually we try to reduce from the lingual, so we do not affect the facial aesthetics of the anterior teeth. Once all the high points are removed, you can then double check with shim stock to make sure the occlusion is tight during protrusive movement. Once all these steps are complete, you are now done with exercise 9.